vaccine protects you from COVID and protects your loved ones and those around you and in your community. The more people we have vaccinated against this virus, the better protected we all are, and there is strength in numbers. High vaccination rates is key to protecting people from severe illness, ending the crisis phase of the pandemic, and helping everyone return to normal activities. One of these normal activities is the return to school tomorrow, and the back-to-school plan developed by the Department of Education and the school districts includes public health guidance for both low-risk and high-risk scenarios. Thankfully, the majority of students in our province will return to a low-risk environment. Public Health maintains regular communications with the Department of Education and the school districts, and if the situation changes, make no doubt that we are prepared to take action and Western. But, you know, the biggest area of concern is what we announced today. You know, we're going to continue to look at the evidence. We've always said that we'll be looking at everything, and a lot of discussions are still happening. So I guess stay tuned to this station.
Thank you. And also another question that we're getting a lot of inquiries on: as our cases rise and we know that the vaccine isn't 100% effective, some of its benefits are to keep you out of hospital. Many people wondering how many breakthrough cases we do have in the province.
So we have seen a number of breakthrough cases, and just if you can bear with me for 1 second, I may actually have that information right here. At the moment, let me see. Yeah, so those 14 days after dose 2, which is what we would consider, so since the beginning of our vaccine program, which would have been December 16th, we've had 31 full breakthrough cases.
But I think it's
out of 1,150, sorry.
Yeah, and it's worth noting that hospitalizations are not directly related to any of those, correct?
No, as far as I know, no.
Okay. So you're 36 more times likely to be admitted to hospital if you get COVID-19 and you don't have a vaccine than if you do. So again, further evidence of the benefits of a vaccine.
We will now go to the phone. Our next question is from Meg Roberts with CBC. Please go ahead.
I was wondering what the vaccination rate in Roddickton is. As we're hearing, it's under 60%.
So we don't have the vaccine rate for each individual community, but we will say in that area, that is correct, that it is under 60%.
And, you know, future lockdowns possible, where do you stand on that? Do you see us going into that kind of situation, you know, in the upcoming months?
So I think, you know, our goal is to avoid that at all costs. And certainly I think we see when you have a largely, well, you know, you have a significant proportion of the population that's unvaccinated, how different the spread can be as compared to situations when you have a significant proportion of the at-risk population who are vaccinated. And we've seen that in like the clusters that we had in Eastern, you know, where we had a few cases at the beginning and then there wasn't a lot of spread because we had a high vaccination rate in those at-risk, the populations that were at risk or that were exposed in the beginning. So, you know, I think the evidence is quite clear that even though you can still get infected when you have the vaccine, or 2 doses of the vaccine, you're less likely to spread it. You're far less likely to get seriously ill and end up in hospital. So as opposed to a situation where we're seeing a large proportion of the population that's unvaccinated, especially with this Delta variant, if it gets into a situation, you know, where we have the majority of people unvaccinated in an enclosed space, in close quarters, not wearing masks, it's going to spread very, very quickly.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I'm not sure who wants to take this question, but the fallout of the George Street Festival this year seems to be that there are no consequences for flagrant violations of pandemic measures. No one seemed to take responsibility for it, either the people who held it or any department of government. What message does that send, do you think?
Want to take it?
I think, Peter, we have a complaints-driven process. A posting on Facebook doesn't constitute one. My understanding is that prior to the weekend, I was not aware of any complaints through our line. They would then be handed off to whichever jurisdiction was appropriate. So law enforcement, Service NL, GGSNL, in the case of an establishment with a license to serve food, and the Newfoundland and Labrador Liquor Corporation. The facts of the case is that they had a plan, and the plan on paper was vetted by public health and advice provided to them, and they were under instructions to follow it. We have, as yet, in my department, not had any formal complaints or allegations that this was not the case.
Okay, thank you. In terms of the taking firm action, if you bring in the vaccine mandates and passports, there's a potential for a kind of a violent reaction from those who simply don't understand vaccines. Is the government considering taking more strict targeted measures to avoid any kinds of conflicts that this might create?
Well, I think introducing vaccine passports to be utilized when the evidence and the epidemiology would support is a good thing that will nudge people towards making the right decision to protect themselves, the economy, and their communities. This is not a decision that we take lightly, and it's something certainly that in the balance of freedoms, we'd certainly put time restrictions on. But it will allow, should another wave occur, like in certain areas around the province that may have lower vaccination rates, the economy, the businesses to stay open and frankly to not penalize those who have made the right choice, the educated choice to get a vaccine. So, of course, you know, we see that there is some angst about the vaccines, but I again repeat my initial comments. Vaccines work. They work for smallpox. They work for polio. They've been one of the best inventions humankind has ever created in terms of our longevity and our ability to continue despite these microbacterial infections. So, you know, there will always be some resistance to whatever you do, and certainly no vaccine campaign is always perfect. But we certainly will be taking the measures when appropriate to make sure that we hit the highest rates of vaccination in our province to protect our communities.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. With schools opening tomorrow, do we have any updated numbers or stats on how many young people between 12 and 18 years old have been vaccinated in this province?
Sure. At the moment, at the provincial level, between 12 and 19 is what our cutoff is. We have just about 70% of those people are fully vaccinated, and about 84% have received at least one dose of the vaccine. This was as of day before yesterday, I think.
Which is an excellent start.
Thank you. And jumping off of Peter's question a little bit, why did we decide to go with the Quebec model for vaccine passports, and how do you envision them being used in this province?
Well, after we did a jurisdictional scan, this seemed to be the best model to move forward with instead of trying to recreate the wheel. It certainly seemed to be the one that had been piloted, tested, and had what we believe to be the best security available. So that's why that model was chosen. Of course, the federal government is still working towards one, and we believe that their passport will have to communicate with the provinces. So in ensuring that ours is similar to others will certainly allow and afford for a more synergistic approach there as well. But we kind of looked across the country, and again, instead of recreating the wheel, using another wheel, we felt that Quebec had done a good job in developing theirs. It's as simple as that.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. Also on the vaccine passport front, obviously this is still in the works as it's being rolled out, but are we looking at a QR code? Are we looking at a printed form, knowing that not everyone has a smartphone or cell access in this province?
Sure, it's QR-based, similar in Quebec, with the ability to print and then scan should you not have access. And we are looking at recognizing that not everybody has access to those devices and ability to print that on a card. The nice thing about this system is it does not rely on, is my understanding, on full connectivity. It lives on the device, and so you will be able to use it without having Wi-Fi availability.
And how do you see employers enforcing this for businesses to go in and out of what the measures will be, or how people will access exemptions?
So exemptions for medical reasons will be buried in the device. So my understanding of the Quebec is you screen, and Minister, you can weigh in here. It reads it, and then it'll either give a red or a green code. And so, if you have a medical exemption, allergy, subsequent poor reactions to vaccines, what have you, then it would still come up green.
The Registrar of the College of Physicians and Surgeons is in the process of preparing a guideline document for physicians who may be asked to provide medical exemptions, and there will be criteria and recommendations there, and that will be out in time for the launch of this system.
Thank you. Our next questions are from Meg Roberts with CBC. Please go ahead.
You mentioned wearing masks inside as a way to build barriers, Dr. Fitzgerald, and that those in the Northern Peninsula should now be wearing masks indoors. Will you be bringing back a province-wide mask mandate? And are you strongly suggested people wear masks?
Yeah, so, I've strongly suggested, or not suggested, but strongly recommended that people wear masks even from the time that we took the mask mandate out. That is still public health's recommendation, is that we wear a mask when indoors, especially in crowded spaces. And right now, as part of the level 3, going to level 3, that will include a mask mandate for that area on the Northern Peninsula. With regard to province-wide, we're having conversations. We're trying to make decisions based on what we're seeing happening elsewhere in the country, what we're seeing happening with the Delta variant, what we know is happening, what the evidence is showing us. So we're looking at all of that. And as we've said many, many times, if the evidence tells us we need to move to that direction, then, that will be we'll certainly won't hesitate to do so.
Safe to say the best way to keep the mask off is to get the shot in, though, all the same.
Thank you.
Do you have a follow-up, Meg?
Nope, that's it.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Given the number of breakthrough cases, which is much higher than any previous vaccine trials would have suggested, do you feel the likelihood of reaching anything resembling herd immunity is a bit of a pipe dream, or is that something that we will eventually see, do you think?
So I think eventually we can get to herd immunity. There are lots of vaccines that, may not prevent you from contracting disease, but prevent you from getting severely ill, right? And that's what we're looking at with this. So while these breakthrough cases can happen, people generally are not ending up in hospital or not ending up severely ill. So that's still very, very important when we're talking about a disease like this. So I think, obviously herd immunity is not something we can think of until we can get children under the age of 12 vaccinated, because we have a significant proportion of the herd that can't get a vaccine. You can't get herd immunity. But what we can get is somewhere very close to that. If we can get close to 90% of the eligible population vaccinated even before we think about vaccinating kids under 12, that still provides an incredible level of protection to the community and to those children. We know that people who can't get vaccinated for many different reasons are protected when we have significant proportions of the population that are vaccinated, because the disease has nowhere to go, really. So it's really important for all of us to step up, those of us who are eligible for the vaccine, to step up and get 2 doses and become fully vaccinated.
Okay, thank you. And I'm wondering if the province is still conducting wastewater tests and where those would be taking place.
Yeah, we are still doing wastewater testing. In fact, week before last, I don't know, time is blending together, but we did have a notification that we had a high confidence result in Paradise, and we were asking people in Paradise with symptoms to get tested. So we are still working on wastewater. We're hoping to expand it a little bit further. Right now we're having St. John's, Paradise, CBS. We have a site at Memorial, using wastewater testing there, as well as in Gander. And we're working to increase the number of communities across the province and into Labrador as well.
Just for clarification, the subsequent test in Paradise came back okay, correct?
It came back low, yeah.
Okay, yeah, I assumed that because there wasn't a report afterwards. Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. It's been said that this cluster of cases on the northern peninsula, that there's a large number of contacts involved. I'm wondering if you can give us an idea of just how many contacts we're talking about here. What's the scope that public health is dealing with?
At the moment, we are talking, I think somewhere between 230 and 250 contacts that they're dealing with at the moment. There's a couple of large gatherings in there, as well as a larger workplace. So it's and people are. Generally speaking, people are having lots of contacts with others now, lots of close contacts. So, it does put us. It's a challenge for the public health in Labrador-Grenfell region to look at that number, right? I mean, public health staff is done by population, so even though 250 may not seem like a lot in Eastern Health terms, in Labrador-Grenfell Health, that's a lot of contacts to have to be traced by their public health team, who are doing a phenomenal job, I have to say. After this weekend, it's incredible the amount of work that they have done to put up vaccination clinics, to put up testing clinics. It's just incredible. And once again, has been proven many times throughout this pandemic, the teams in the regional health authorities have risen to the challenge, and they're just an incredible bunch of people. I'm so proud and privileged to say that they're my colleagues.
And keeping with that cluster on the Northern Peninsula, it was mentioned in your earlier comments that this is being driven by the Delta variant. Are all of the cases that we're seeing in the province now associated with the Delta variant?
Yeah, any that we have been able to subtype, because there are some that, you're not able to do that, have been Delta. Since... I can't tell you exactly how far back that goes, but it's certainly been in the last month. Everything has been Delta.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us. Certainly want to echo my colleagues' appreciation for the people in Lab-Grenfell and Western Health for working hard on Labor Day weekend to ensure the safety of people in that part of the province. And again, encourage everyone to get vaccinated. It is the best thing we can possibly do to get ourselves out of this pandemic. We are getting there. We're very close, but we need everyone to push a little bit harder. Please, I encourage you all, get educated when it comes to vaccines. They work. They have worked for quite some time, and they will work for you and your communities. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
Of the preceding program, we now join the regularly scheduled program already in progress.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
Hey everybody, what's up? It's your boy DC, and I am the Thursday night host of St. John's local tradition, Out of the Fog. You know, local matters here on the show, and from arts and business, not-for-profit, anybody doing anything great to make our province a more rewarding place to live and work. It all happens right here in the studio. So join me and my boy DJ Slim Macho every Thursday night for Out of the Fog.
It was my daughter's birthday. She was blowing out the candles on her cake when we heard coming from the TV. So we stopped and listened, and it helped us get to safety. That's why when I think of my daughter's birthday, because now she gets to keep having them.
Hi, I'm Darren Hand. We have an exciting new show coming this fall called Pocket Universe. We introduce you to a variety of artists, filmmakers, and actors who share my love of sci-fi, horror, and all things out of this world. Newfoundland and Labrador has so many talented people in this genre that we can't wait to have them tell you their stories. Watch out for Pocket Universe coming this fall to Rogers TV, Channel 9.
Go to a graveyard to visit your loved one?
Definitely not. Like those points and between churches and funerals and wakes and headstones. Yes, it's a beautiful place. If your soul and your body feels like you would like to go, that's fine. Some people don't like to go, and that's fine too, just because it brings back memories. Or they like to say, I like to stay home and talk to mom instead. Perfect, because that's exactly where she is too. Intention is I want to go. Some people are just so busy, and to honor them, I go to a headstone. That's legit, because it gives them the intention of, okay, this is time for me now to focus on mom. And I love that time spent now with mom. And I'm honoring it by giving her flowers. Beautiful. But you can also be on your living room couch and say, Mom, I really miss you today. And I absolutely can't fathom that I have to do this anymore this way. But I know this deep down inside, this is exactly where you are still. And that's exactly what they hear.
Wow, that is truly lovely, Leslie, and so reassuring. And before you make me cry, let's move on. And I'm wondering if you can just describe some typical signs that someone might get from a loved one. How can they come through to us?
Sure, yeah, and that's a good one, Roberta, because everyone's always asking for signs, and people are being so aware now that you can ask for them and have them. I say bonus when people get upset and say, Mom, I'm asking for signs all the time for Dad, or I'm asking, if they would only give me this. What I tell people is, please, perfect. If you want to be specific, that's great. If you want to say specific, but to get it back specifically, that's a bonus, I tell people, because you have to look at it from their side. When we're asking them, what if they're here and going, oh my God, I really can't do that, but I can do this? Because we don't know energetically right now what that person can do. And we're asking them probably the impossibility of, oh my gosh, right? They're like, oh my God, I would love to give it to them, but I really, I'm in this form and I would love that. Bonus if it do, because it do happen. If someone says something particular, I've had that in reading. Some people will be like, oh my God, you told me exactly what I want Mom to say, right? That happens. But the signs, when people usually get them, it's the expectation. Keep it open. Say, please just give me a sign today to understand that, what I'm going through, you understand. That's legit. Then we'll be open to it. That's why I tell people, be open to your expectations of how it will come to you, because we have to give the onus on them. We have to let them know they have to give it to us. So let the miracles happen through them and let them show us that way. Right. But some things are that they really do, if we get down to some of them, dimes are a big deal. Birds are a really big deal. Butterflies are a big deal, because that's easy, right? We can have things happen, nature-wise, right? Thank you, Archangel Michael, who just showed me. Nature-wise, those things, feathers are a big deal. You probably heard of feathers. And numbers. Numbers are starting to happen more now too. So that's right.
Yeah, I see a lot of repeating numbers, on my phone, on license plates, and just always. Yeah,
exactly.
Always. Yeah.
Yeah. Or I think Michael wanted me to point out songs. Songs are big. So radio, and the first thing you think about is that person. That's why. It's not just a memory. It's because your body's picking up that this person's still here, and they think it's so cool, like, look what I can do. Or if you, no rhyme, like no coincidence when you wake up or when you go to bed or during the day and say, why is that song stuck in my head? Why? And it's because, and it reminds, oh, so that reminds me of Mom. And that's when you think about her, because she's there, your body's picking up that she's there, and that song goes to make sure that there, right?
So many little ways that seem really insignificant, but they're not.
When you believe, it opens up the door for so much.
I'm so glad you said that, because I know sometimes people say to me that someone significant has passed away and that I don't feel them, or I'm looking for signs and I don't get them. And I'm like, well, have you asked? Like, have you really asked? Because if you're not sure, you don't really believe, or there's a lot of fear energy around it, I find that it blocks the signs from coming in and the messages. And if you just have an open heart and ask and not need, like, I feel like too, sometimes people want something big,
right?
An apparition to appear or something.
Yeah, we all want that big miracle, that the strike you down, that all of a sudden is there. And it happens. I have beautiful people that message me all the time and said, this just happened to my dad, and he's living, he saw this, and that happens. It's there, it's legit. I call it the bonus ones still.
Right.
But it's the defining ones that we have to look for. Like, say you're you're thinking of them, or all of a sudden you're probably in the car crying in the parking lot because you're really thinking of them, and you're going into the store and you might hear someone's conversation back and forth with somebody else, and they're picking up on the key words that makes you think about their mom, or something that you did when she was alive just before she passed. They could be talking about a certain camping trip at a certain area, and you probably were already there just with her. Those types of things. That's the signs. Those are the things they can do. There's no coincidences.
I was just going to say that there is no such thing as coincidence. Like, I don't believe in coincidence.
No, none.
Oh, Leslie, I have to, I guess, address the archangel in the room.
Right.
A couple of times now you have referenced that you are receiving communications or messages from Archangel Michael. Can you expand on that, please?
I will. We all have a team. So I have a team, you have a team, every one of your audience members have a team, every beautiful friend that we know, relative, and I'll call you an antenna. Every antenna comes with a team. That includes all your angels, archangels, and all your passed over loved ones. All of them. All of them. So we all have a big team. So what helps us every day is we are born with a guardian angel. Then we get different angels who see us in times of, like, say, different things, job-related stuff, relationship stuff, things when you just really realize some people can get down on your knees and realize, like, oh my God, I just can't do this no more. Those type of moments, you guaranteed you get a different angel for all that. So when I happen to channel, there's a filter that comes through me because there's so many. So I don't get blown up, my brain, overwhelmed. I usually have one channeler who's always with me. And since COVID, God love him, but since COVID, it's been Archangel Michael, and he's been there for people so much. And from what I can gather, of course, it's a big protection thing. He can be there for a lot of people, but he happens to be one of my main channelers now. Usually they switch out every 2 or 3 months, but he happens to be, he just laughed. He said, still alive and kicking. He has such funny humor. They're so fun. They're so fun. But I'm there. Yes, I'm constantly in at the same wave and frequency as them so that they can get in at the same time.
And it definitely seems like it does bring you a lot of joy to do this.
Mm. And it's funny, like, people ask, like, Leslie, do you even get mad still? Like, do you get mad with them? I say, absolutely, I do. I'm just like everybody else. There's sometimes I'll roll my eyes and go, nope, I'm not saying that, or I'm not thinking that. I don't want, or stuff happens to me too, right? Stuff happens at home, and I'm like, nope, not today. I'm not doing this. Why am I cycling the same thing? Why is this issue coming with the house? All the same thing. Everything happens to me. I still look at the universe and go, why?
So having this ability doesn't mean that you're just skating through life and everything's just beautiful in your existence, huh?
It just brings more joy. The belief in it and the opening and the heart and just the awareness, and it's that you fill that gap that you already knew that there was something there, right? It's filling that gap. So that brings the joy. That brings, no matter, because we came here to exist. So we came here to be and have things happen to us. That's what we came for. There. He just showed me, it looked like that. Yeah, thank you. He just showed me like the image of sugarcoating. They like to make it a little bit better for us, a little bit more sweeter for us, a little bit more, he said, to cut right to the chase, he said, and get more in there. It helps us. Sweetens the deal, he just said. He's a funny one.
So, Leslie, let me ask you this. Does everyone get there? Does everyone get into the afterlife or heaven or whatever you want to call it? Everyone?
Good question. I get that a lot. Seeing how, we know of certain people or hear of things on the news of different people and circumstances, yes. But for all intents and purposes, we all go to the same place. Heaven exists for everybody. There's no fear in it. No, I have loved ones, even especially with, suicide or things that they have done wrong for what they feel that they have done wrong. Everyone goes to the same place. We're always guided once we get there. We always have help. We have our angels and they have guides, and we have past loved ones who will help. What we do is just more of judging ourselves. It's more of a time for us to reflect, believe it or not. They are always with us, helping us, because as you can imagine, when we pass, we're in a total state of bliss by that time. So then when we actually see what we did here, or say if we did something wrong or what we could think wrong, because there is no wrong in the eyes of faith. It's just more of when we see that and encompass that, oh my gosh, look what I did in that life. Oh my gosh. Then we say, I want to write it. I want to make that better. I want to make me better. I want to do that better next time.
Okay. So what about if someone passes suddenly, or maybe you have a family member that you've not spoken to in years, and then something happens and that person passes and you're filled with all these regrets that maybe your last interaction was negative. Maybe there was an argument, a fight, and you wish you could make it up to them somehow or fix it somehow, but you feel like it's too late. What do you say to those people?
I say, first I'd like to say I'm sorry. First I say I'm sorry you feel like that, but I can actually tell you that it's left for you. So let's move past it. It's human. So because they don't feel like that. And I can promise you, when they leave, we don't have this beautiful, but it's temporary organic body that makes us feel these things. We're here on earth. We get to feel anger. We get to feel fights. We get to feel jealousy, guilt, remorse, regret. That's for us. We are left with that. So once we don't no longer have this body and we go back to this energy form, we don't need that. We can actually have those feelings no more. So when they pass, they say, oh my gosh, I love my family. I love my friends. I love that, because they can understand love. Even when, say, if we had an argument, so it's for that person that's left here, that loved one who is here grieving that passing. Unfortunately, that's what they're left with. So if I could get from A to B to be able to fill that gap for them, to say, you do not have to worry that your mom or your dad or your brother left with you hating them even at the same time. Maybe that was a thing, but you never ever have to worry that that's what they feel, or if they couldn't pass, or I never had that closure. The closure then is for this reader or for this one that's left here. That's unfortunate. So let's move past that and let me heal you through that instead.
So over there, there's nothing but love.
Nothing but love. Yeah. They understand our worry. They can see when we worry, say. They can understand that we go through hardships. They understand that. But they help put more in place to give us those signs to say, I'm here and I'm still with you. Let's get through this together. That's what they do.
Leslie, I could talk to you about this all day, and I can't believe our time is up this quickly. But if someone wants to make an appointment with you and have a reading done by you, how can they find you?
The best way to find me is literally on Facebook. I hate using the word, but Facebook, under Leslie Rumsey, the Happy Medium.
Leslie, it was such a pleasure chatting with you today. And I know you're helping so many people deal with grief and communicate with their loved ones. And just thank you. Thank you so much.
Oh, thank you. Thank you for having me. It's been beautiful. And we could talk more forever.
Okay. We will. Thank you.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
If you have a comment about this program, we'd love to hear it. Email or call us, or send us your feedback through social media.
Hey everyone, it is Jason Piercy, host of Out of the Fog on Tuesday nights at 7:30. You're definitely going to want to watch because you never know what I'm going to get into. It's all about community. It's all about you. So watch Tuesday, 7:30.
If you only knew what I'm going through, I just can't smile without you.
Hi, I'm Darren Hand. We have an exciting new show coming this fall called Pocket Universe. We introduce you to a variety of artists, filmmakers, and actors who share my love of sci-fi, horror, and all things out of this world. Newfoundland and Labrador has so many talented people in this genre that we can't wait to have them tell you their stories. Watch out for Pocket Universe coming this fall to Rogers TV, Channel 9.